A Maryland teacher. We will find out more coming up. First tonight, we focus on two conditions that can affect your vision. Joining us in the studio for this week's Your Health segment is Dr. Osama Saidi, an assistant professor of ophthalmology and visual sciences at the University of Maryland School of Medicine, practicing ophthalmologist at the University of Maryland Medical Center. Doctor, thank you for being with us.
Thanks for having me.
We're excited to talk about cataracts and glaucoma, and I was thinking about my last visit to an eye doctor just for a prescription update, and they do that little puff test.
Yeah.
Which is not to check for your blinking ability, right?
No.
Let's start there, because people are familiar with it. What are you actually looking for?
So great question. So when you do the puff test, you're checking for pressure in the eye. And it is one of the ways to screen for whether pressure is very high or very low. It's not the most accurate way of doing it, but you'll frequently see that when you go to the optometrist or in other settings like that. And so pressure is very important, especially when it has to do with glaucoma, one of the diseases that we're talking about today. So glaucoma is a disease of the optic nerve. It has to do with degeneration or deterioration of the optic nerve. It's an age-related disease, and it is one of the leading causes of blindness worldwide, and it causes the leading cause of irreversible blindness as well. And so it's estimated about 3 million people in the U.S., or close to 3 million people, have glaucoma, and it is more and more common as you get older. So it's about 2 or 3% prevalence overall, but as in the age group over 80, it's up to 8 or 9% as well.
The ophthalmologist version of the puff test is the thing with the blue light.
Exactly correct. Yeah. So it sounds like you've been there too.
Yeah.
Right. So we numb the eye and we use some blue light, and then a small probe will get very close to the eye to check the pressure, and that's as accurate as we can get currently.
You know, when you say close to the eye, I thought it actually touched.
You can actually feel it. Absolutely. It gets right on the tear film, and you can feel it.
What's the relative accuracy of those two tests?
I would say that the puff is a good way to screen. It'll get you in the ballpark, and that the Goldman applanation tonometer, which is the blue light, is again, as accurate as we can get to knowing what the pressure is in the eye currently.
And how accurate is that in picking up glaucoma at a stage where you can do something about it?
Right, so that's a great question. So we know that about a third of patients have glaucoma at normal pressures, and that was done with some great work was done here at the Baltimore Eye Disease Survey. And so in terms of picking up glaucoma, just screening for glaucoma, checking the eye pressure itself isn't really enough. So especially if you're at high risk for glaucoma, particularly if you have a family history of glaucoma, you really need a full eye exam. Somebody has to dilate the eye, and if there is some suspicion for glaucoma, they should formally test your visual field. And so in glaucoma, the deterioration or the damage to the optic nerve can cause loss of peripheral field, and we can test that formally with a special test.
Okay, I'll come back to that in a minute. Let's talk about cataracts for a second, because you helpfully brought a giant plastic eyeball with you, which gets us into the cataract discussion, and everybody, there's a lens in there.
Absolutely. So this is the eye, and so the rays of light, as you can see, can come in the front of the eye, the cornea, and they get focused by both the cornea and the lens to the retina, the back of the eye, to the photoreceptors there. And so the cataract is basically your native lens over here that has become opacified. And that's a normal process.
Cloudy is the non-scientific.
Cloudy, exactly correct. It gets cloudy. And so it is a normal age-related process, and so we say that above the age of 40, most people have a cataract, but that's not something that you're going to have to worry about. By and large, that's something that doesn't affect vision, but over age, that can become cloudier and cloudier to where it's something that causes blurriness. People will often complain of halos and glare at night when they're driving. That's sort of sometimes an early symptom of it. And at that point, the therapy for it is basically surgery, and cataract surgery is very successful, and most people who have cataract surgery are very happy with it.
Let me remind our viewers, if you have a question about conditions of the eye, you can give us a call. We'll have the number up on the screen. You could also tweet a question. Our Twitter address is @MPT News. And somebody I know who had cataract surgery actually thought it was an upgrade after the process was over, because he no longer needed eyeglasses for distance. It was somehow built into the replacement lens.
Absolutely. So before somebody gets cataract surgery, we do very careful measurements. We measure the length of the eye, the curvature of the eye, and the lens so when we do cataract surgery, we take out the lens You can see we take this lens out,
It's just that easy, right? Yeah.
and then through a very tiny incision, a approximately 2 to 3 millimeter incision, we can what we say emulsify and aspirate. We basically suck out the lens and we put in a plastic lens, and that plastic lens is fit right to your eye. So then you may have needed thicker glasses, but once we put that lens in, you, for distance at least, will not need glasses.
How do we prevent needing this? Is everybody over time it's just going to happen?
Yeah, so I mean, there's some great research going on, but currently cataract is not something that we really know how to prevent. I mean, it is an age-related process. There are certain things that are more put you more at risk for cataract: diabetes, steroids, steroid use for whatever medical reason, and trauma as well. But currently there's no actual preventative medication or therapy.
A bunch of phone calls for you. Let's talk to Leroy in Baltimore City. Leroy, thanks for calling. Go ahead.
Thank you. There are different pressures in glaucoma. There's a different pressure from person to person. How do you determine what pressure is suitable for a particular case of glaucoma?
Great question. Thank you, sir.
So this clearly is a very sophisticated viewer, and so when we talk about pressure in glaucoma, we really normal pressure is about 12 to 21. About 95% of people live within that range, but for somebody who has glaucoma, we want a very low pressure because we don't want their disease to progress. The way we treat glaucoma is by lowering the pressure in the eye. And so if somebody had very advanced glaucoma, I would want a very low pressure. And so if somebody had very mild glaucoma, it wouldn't necessarily be as low. And we talk about reducing the pressure about 30%. So it's not an absolute number, it's more of a relative number.
Let's go to Anne Arundel County. This is May. May, thank you for calling. Go ahead.
Hi, how you doing?
Good. How are you?
Fine, thank you. My husband is blind by both 7 years ago. Could you tell me what could be done for him to at least regain one of his sight?
Well, it's hard for me to know what exactly is the reason for your husband's loss of vision.
May, if you're still there, was it glaucoma related or something else?
Howard, could you answer that question, please, Howard?
Yeah, glaucoma and diabetes.
Okay. Thanks. Good luck. We'll get you an answer on the air.
Okay.
I thought I heard diabetes and glaucoma.
So, it's hard to know from what the caller said. Glaucoma, unfortunately, when vision is lost due to glaucoma, it is generally irreversible. So it's an irreversible cause of blindness. Other causes are reversible. So cataract, we say there's a surgery for cataract. It is a reversible cause of blindness. Some retinal diseases, there are injections and things that we can do to improve vision. So it varies from person to person, but glaucoma generally is an irreversible.
So after May's phone call and hearing what can go wrong, a lot of viewers are going to head to the eye doctor, as they ought to get checked out. But to what degree is it hereditary, or do you know how much you need to worry at what age?
Absolutely. So it is an age-related condition. The American Academy of Ophthalmology says all people above the age of 60 should get a screening eye exam every couple of years. If you have a family history, you certainly should get a complete eye exam, and in some cases you should get a formal visual field depending on your family history. If your mother, father, brother, sister had glaucoma, you really should get it checked out. If they had it early, you should have an early screening eye exam. And certainly if you're having symptoms, you should get checked out. So, glaucoma is not something people have symptoms with, so really it's something that's only ever picked up when you actually look carefully at the eye and try to diagnose
that makes it scary. I mean, the cataract thing, you know if things are getting fuzzy, you have the halo and it's treatable.
Yeah, I think that as long as people are getting regular eye exams, I think that, and getting appropriate eye care, I think that they will be appropriately screened. But certainly if you have a family history or you're in a higher risk group, you should be screened earlier.
Let's talk to Anita in Prince George's County. Anita, thank you for calling. Go ahead.
Hi.
Hi.
I have Stevens-Johnson syndrome, but I do also have been diagnosed with a cataract. And I'm having the halo and the cloud, and sometimes I'm legally blind. The vision disappears, and I'm wondering at what point should I try and push my doctor to do something about it.
So you should, I'm sure your doctor is taking good care of you, and you should, sort of listen to his or her advice. Obviously, you have a couple of conditions in the eye, so it's hard for me to say. those are decisions that are made by somebody who would be doing surgery or somebody who would be treating.
Let me jump in there. Who does the surgery? Is it any ophthalmologist?
Yeah, so general ophthalmologists, their bread and butter is cataract surgery, but most ophthalmologists, they can be general ophthalmologists, cornea specialists, glaucoma specialists, can do the surgery. Absolutely.
Anne Arundel County, this is David. David, thank you for the call. Go ahead.
You said after the cataract surgery, I don't need glass for distance. But what happens to me is without glass, I can only see the distance of my hand. For any distance, I have to wear glass. Is there anything goes wrong
David,
in the surgery?
Thank you. We'll get you an answer on the air. So it sounds like just what we talked about, the new lens sees like an eagle at a distance, but the near field went fuzzier.
So I should actually clarify my point before. We aim to reduce the dependence on glasses, and many people will see without glasses, but many people will need a small correction to see perfect in distance. Now, if we set the vision perfectly for distance, then typically you will still need to use reading glasses. There are different strategies to deal with that. There's what we call monovision, one eye for distance, one eye for near. There are new multifocal lenses, which are kind of like bifocals in the eye. So those are some things to talk to your doctor about before you get your cataract surgery.
Yeah, I think I understand that, because with these glasses on, I can see distance great, but if I look through it, it's all fuzzy.
Right.
And it would be like having that permanently.
Exactly. If you have the standard distance lens, absolutely.
Yeah. Wicomico County, this is Linda. Linda, thank you for calling. Go ahead.
I just to go to your comment about the multifocal lenses. I'm getting ready to have cataract surgery, and I was going to go for the upgrade on the multifocal lenses, and I wondered how you felt about those.
I think that some of the multifocal lenses are great. I think that they are, so those are lenses that you can ask your ophthalmologist about, and they are usually a small premium over the regular lens. Basically, the ophthalmologist needs to determine whether you're a good candidate for it, and if you are, some people are very, very satisfied with them. There are some people who are not as satisfied, but the key is picking out the right candidate as best as you can.
Before we go, you're director of clinical research for ophthalmology at Maryland as well. What are the frontiers here? What are you working on?
Yeah, so some of the stuff we're working on is determining why people get glaucoma. Certainly we know that pressure is very important, but we're also looking at blood flow in the back of the eye. And people with glaucoma, it is thought, have poor blood flow and poor regulation of blood flow. So we're doing some sophisticated imaging of the back of the eye to determine why people get glaucoma as a diagnostic test.
Very good. Dr. Osama Saidi of the University of Maryland, thank you for being with us.
Thank you.
Coming up, Maryland's Teacher of the Year. We'll be right back.
Heather Sanderson here. It's time to award an OTG to this week's loyalty supporter,
Andrew E. of Bowie.
Membership matters. Thanks for helping to put a smile in everyone's day.
Here's your chance to lighten your load and support MPT. Enter the MPT Freedom Raffle to win your choice of a 3-year lease on a Honda Accord hybrid sedan or $15,000 cash and many other prizes. Enter by May 20th for the early bird drawing to win a luxury weekend getaway. Visit MPTFreedomRaffle.com today.
Next time on Antiques Roadshow, we're looking at some of the best presents people ever receive.
It's an expensive Valentine's Day gift to yourself.
Yeah, no, it was from my husband.
It was an expensive Valentine's Day gift from your husband.
You're a lucky guy to get a present like that. Holy smokes. I'm gonna have to give that watch back.
Join us for a generous special episode, Antiques Roadshow Greatest Gifts.
Tonight at 10:30 on MPT. Tonight on MPT.
Antiques Roadshow can't wait to show you the treasures we found in Richmond.
It's Tiffany and Company on the back.
Terrible news, don't you think?
Oh, yeah.
Wow. Oh, my word. Well, I guess I'd have to go to a place of honor.
You won't want to miss these discoveries next time on Antiques Roadshow.
Tonight at 8 on MPT.
Joining us now in the studio is Sean McComb, the National Teacher of the Year. I said you were the Maryland Teacher of the Year a second ago, which is correct, and then an upgrade.
Yeah.
Which got you to the White House. Congratulations on that.
It did. Thank you very much. Yeah, I was proud to be there with the other state teachers of the year in a wonderful ceremony, just celebrating teaching across the country.
And met the president and all that stuff, and your son did as well?
I did. I think, one of the greatest gifts I've been able to give my family through this process was the opportunity for my wife, my son, my father and sisters, and my in-laws to all meet the president along with me. And when we all went into, this was the Blue Room where we got a chance to meet him, he looked over and said, "Give me that baby." And he came over and he scooped up my son Silas, who was 8 weeks old, and he said, "Yeah, you might not know it, but the people around here call me the baby whisperer." And he just starts rocking him right away, and he loves kids, and held him for the family photo. So we're gonna have a really cool family photo when we get it from the White House.
Oh, that's fabulous, and that's an important thing about being a politician, is
right.
Having that rapport with babies, and obviously you have great rapport with students. One of the ironies when they select the Teacher of the Year is that we immediately take that person out of the classroom for a year. Do you have mixed feelings at all about it?
I certainly do. I mean, I love the students at Patapsco High School and working with my colleagues very closely, and so it'll be a little bit bittersweet this year to be away from them, but I just think about all of the growth that I'll have this year and all the experiences gaining from some international travel to see different school systems, but also domestically across the country, and what I'll learn and be able to bring back to Patapsco in coming years.
What's the gig for the next year? You're going to be on the road a bunch.
I am, yeah. So this award is really about being selected as an ambassador or representative for the teaching profession. So I will engage in about 150 speaking engagements over the next calendar year. So there will be a lot of time on the road, a lot of opportunity to kind of share the message about how teaching can really be transformative in the lives of young people. And I'm excited to do that. I mean, I love what I do, and teaching really changed my life. So I'm excited to get out there.
When you talk about it being transformative, tell us your story and how teachers really got you to where you are.
The story of my youth is not too uncommon in America these days. I had a period of time where my family was a low-income family. My parents were divorced. There was a time both my parents experienced some unemployment. But the super challenge was that my mother was battling alcoholism. And in my high school years, it started to get the better of her, and our home life became tumultuous and chaotic. And I really relied on school and some incredible teachers to bring hope into my life. I really let my grades slip, and I wasn't really seeing a great future for myself. But two teachers, Mr. Schertz, my English teacher, and Mr. Reagan, who worked in TV production, they just saw something in me I wasn't able to see in myself. And they encouraged me, and they believed in me, and they valued what I did. And leaving high school, having a chance to go to college because they believed in me, I said to myself, I need to do this work for others.
That's great. And you're just 30 years old.
I am, yeah.
How long have you been at Patapsco High?
So this is my 8th year teaching at Patapsco, all 8 years at Patapsco in Baltimore County, yeah.
All right. Yeah, tell me a little bit about the school, population, and specifically about a program that you and your wife are also involved in there.
Yeah, so Patapsco High School, 1,450 students about in Dundalk in southeast Baltimore County. The program that we've kind of spearheaded over the last several years is called AVID, and stands for Advancement via Individual Determination. And a lot of times we have programs in our schools for your top flying students or to really help bring up your bottom students. This is a program that targets your students in the middle, students that are identified as students of high potential who might not be likely to go on to college if it weren't for some support. So we identify about 30 students coming in as 9th graders, and we pair them with a teacher, and that teacher loops with those students throughout 4 years. So we really take on kind of a coach, player, mentor, teammate kind of relationship, and they take a class as part of their daily schedule that focuses on 3 areas. One is college readiness skills, so a lot of reading and writing, but also habits of mind and time management and those kind of soft skills. Then we do some interventive tutoring. So students are struggling in their biology class or math class. They have an opportunity to bring those questions to class and get help. And then the third is the college process. A lot of the students are first-generation college students and really don't know much about the process and what they should be doing each step of the way.
So are these kids who are a little bit like maybe you were a decade or so ago?
Yeah, I see my story in those kids so often, and that's really what makes the work so fulfilling for me personally. I think teaching is by its nature very fulfilling work, but particularly when I see students who are struggling with a lot of the same issues that I had, and I know that opportunity that's sitting out there for them, I just find myself so motivated to be able to give them a little extra push because I know what's possible.
Let me remind our viewers, if you have a question for the Teacher of the Year, National Teacher of the Year, give us a call. We'll have the number up on the screen. You can also follow Sean's example and tweet something. Our Twitter address is @MPT News. Let's start with Alex in Baltimore City. Alex, thank you for calling. Go ahead.
Good evening, Jeff, and to your guest, and congratulations to his award. My question is, to the teacher, what do you think about the new requirements that Baltimore City and the county schools had during to graduate high school?
Very good. Alex, thank you.
Which particular requirement was he speaking
Well, he was
to?
talking about graduation requirements, and I know there's a number of high school assessment tests you need to pass, but maybe I can broaden it a little bit, and we could talk about standardized testing in general.
Sure. So when we speak about graduation requirements, we're facing this kind of national realization that in order to be college and career ready, that requires a greater skill and a greater ability. And so I think that's what some of our movement in standards, our movement in graduation requirements is trying to work toward, is having more of our students ready to go out and compete in a global workforce. My wife's family is from Dundalk. Her grandfather was able to graduate high school and go become a chemist at Sparrows Point. That's not the career path that our students will face now when they graduate high school. So a lot of these efforts are in order to try to make our students be more prepared. And I think the encouraging news is that we're also graduating students at the highest rate in, I think, 40 years across the country. So while we're trying to raise the standards in order to graduate more ready for college and career, we're also pushing students so that more students are graduating ready to do that work.
It's really interesting when you think about where the school is located, and not just Sparrows Point, but all the other industrial jobs that have largely gone away. They're building the big new Amazon warehouse there. It's going to employ a lot of people, but not pay them a whole lot. Certainly better than nothing. So, I mean, you see college as being really important for most kids, but not everybody. Certainly at Patapsco, I don't know, the number, maybe a third of kids are taking the SAT at this point. You don't have to take the SAT, but it's a little bit of a measure of how many kids are heading for college.
Right. Actually, in Baltimore County, the last 2 years, all juniors are given the opportunity to take the SAT during the school day. So we really are trying to make that test more accessible for more students, because it is an important indicator not only in how well we're doing to educate the students and their abilities, but also for those students who are interested in going to college. It really is a challenge to what we're seeing is that the challenges and the opportunities for college readiness are similar to what students are going to need in order to have those kind of middle-class lives and careers that are going to give them fulfilling work and stable lives. But you're right to speak to some of those jobs that are just disappearing, those blue-collar jobs that could, in the past, have given a middle-class life.
Let's talk to Marie in Baltimore County. Marie, thank you. Go ahead.
Hi.
Hi.
Congratulations, and I'd like to know if it's possible to come in and sit at one of your classes. I live in the area, and I'd love to come in and see what goes on.
That's a great question, Marie. Thank you for the phone call. Have you had that one before?
I haven't had that one before,
and
but
you're not going to be in the classroom for a while.
No, not for a while. But I think that speaks to the idea that the community should be involved in what's happening in school. And I think that it's really important to have those important community ties to what's happening in school and have the support of the community and make sure that our community members feel like they are an important stakeholder in what's happening in the school. I think one of the great parts about public education is that it is a public good and it's in all of our best interests to have great public schools and great students graduating from those public schools. So come on in and let's see what's happening. Let's make sure we can get the best education possible.
Yeah, and it may not be Patapsco High, but there's certainly a school in the area that could use some volunteers.
Absolutely.
And certainly the elementary, the middle school level, maybe that's more of a thing.
Absolutely, yeah.
Very good. Sean McComb, the new National Teacher of the Year. Congratulations to you. Thanks for coming in.
Thank you.
Appreciate it. Thursday night at this time on Your Money and Business, a local underwater operations company is making international news and taking part in the search for Malaysian Air Flight 370. That's Thursday night at 7:30 on Your Money and Business. And join us Friday at 7:30 for State Circle. Now, for all of us here at MPT, I'm Jeff Salkin. Thanks for watching Direct Connection, and have a good night.
Your Health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.